Your spine is not just a stack of bones holding up your head. It is a living, geometric antenna, transmitting the intelligence of your nervous system to every part of your body. And when its geometry is precise, your body's capacity to heal becomes almost limitless. Dr. Vic Naumov calls this his Somato-Geo Technique, SGT, a visionary and revolutionary approach he developed over the last 25 years that goes far beyond a traditional chiropractic adjustment. Welcome back to You Are the Medicine, the audiobook by Dr. Vic Naumov. Copyright 2025. All rights reserved. This is episode 4. This episode is going to show you exactly how geometry becomes healing. Hit like, drop a comment, and let us know where you're tuning in from. And share this with someone who needs to hear it. Subscribe and turn on that notification bell. We're just getting started. Let's begin. Now, let's step into the Somato-Geo Technique, SGT. Dr. Naumov opens this chapter by redefining something you thought you already understood: your own spine. Your spine, he writes, functions as a living geometric antenna, transmitting the intelligence of your nervous system throughout your entire body, while maintaining the precise structural relationships that optimize electromagnetic communication between every cell, tissue, and organ system. When your spine maintains optimal geometric alignment, he says, this transmission occurs with crystal clarity, enabling your body to demonstrate its remarkable capacity for healing, adaptation, and optimal function. When spinal geometry becomes compromised through trauma, repetitive stress, or degenerative change, he explains, the transmission of nerve impulses becomes distorted, creating interference patterns that compromise your body's ability to coordinate healing responses. Traditional chiropractic care, Dr. Naumov argues, focuses primarily on restoring mechanical function to spinal joints, improving range of motion, reducing pain. But these approaches, he says, often miss the deeper geometric and electromagnetic principles that govern how spinal alignment affects your entire body's function. This is where the Somato-Geo Technique, SGT, comes in. Dr. Naumov describes it as a revolutionary advancement in spinal care that specifically targets the geometric relationships and electromagnetic properties of spinal alignment in order to optimize your body's frequency patterns and healing capacity. Every spinal segment, he explains, exists in a precise geometric relationship with every other segment, creating a three-dimensional matrix that either enhances or interferes with the electromagnetic fields generated by your nervous system. When these relationships are optimized through corrections based on mathematical principles rather than mechanical considerations alone, the improvements often seem remarkable because they address the fundamental organizing principles that govern all biological processes. You are the medicine, Dr. Naumov writes, and the Somato-Geo Technique provides the geometric precision necessary to remove the structural interference that prevents your body's innate healing intelligence from expressing itself at its highest capacity. End quote. Dr. Naumov. Conventional chiropractic care, Dr. Naumov writes, operates from a mechanical model, viewing spinal problems as joint restrictions to be corrected through manipulation, designed to restore normal motion and reduce local pain. This approach, he says, often provides temporary relief, but it fails to address the deeper geometric and electromagnetic principles that determine how spinal alignment affects your body's overall healing capacity. Traditional chiropractic adjustments, he explains, typically focus on individual segments treated as isolated mechanical problems, missing the reality that your spine functions as an integrated geometric system, where problems in one area create compensatory changes throughout the entire structure. His visionary and paradigm-shifting Somato-Geo Technique, Dr. Naumov writes, transcends this limitation by assessing your entire spine as an integrated geometric system, identifying patterns of distortion that compromise electromagnetic function and designing correction strategies that restore optimal geometric relationships throughout the whole structure. This systemic approach, he says, produces more comprehensive and lasting improvement because it addresses the underlying geometric cause rather than just the mechanical symptom. The principles guiding these adjustments, he explains, are based on the same mathematical relationships that govern optimal structure throughout nature. The golden ratio proportions found in the most efficient biological designs, and the spiral patterns that optimize energy transmission through living systems. When your spine maintains these relationships, it functions as a highly efficient bioantenna. Somato-Geo adjustments, Dr. Naumov writes, are delivered with precise vector forces that restore specific geometric angles and spatial relationships, not just joint motion. This requires extensive training in geometric analysis and electromagnetic principles, because the practitioner must understand exactly how each correction affects the overall geometric matrix of the spine. Because of this electromagnetic focus, he explains, corrections often produce improvements that extend far beyond the area being adjusted, patients frequently reporting better sleep, more energy, sharper mental clarity, and stronger immune function, because these improvements result from enhanced electromagnetic coordination between all body systems. Somato-Geo corrections, Dr. Naumov notes, are typically gentler than traditional adjustments, because they work with your body's geometric intelligence rather than forcing change through mechanical manipulation. And the results tend to last, he says, because geometric corrections address the fundamental organizing principles that maintain spinal stability rather than providing temporary mechanical relief. Your nervous system, Dr. Naumov explains, transmits information using electrical impulses that travel at specific frequencies, creating electromagnetic field patterns that coordinate everything from heartbeat regulation to immune response. These frequencies, he says, must maintain precise characteristics for clear communication between your brain and every part of your body. When your spine maintains optimal geometric alignment, he writes, nerve signals travel with minimal distortion. The geometric relationships between segments actually create resonance chambers that amplify and clarify these signals, enhancing the coherence that allows your body's systems to work together harmoniously. When spinal geometry becomes compromised, he explains, the altered relationships create interference that distorts nerve signal frequency, leading to communication breakdown between your brain and your body's systems. These distortions, Dr. Naumov notes, often occur long before you feel pain or notice any obvious symptom. The Somato-Geo technique, he writes, specifically targets these frequency distortions, identifying the geometric alterations that create electromagnetic interference and delivering precise corrections designed to optimize nerve signal clarity and coherence, not just mechanical motion. As founder of Somatic Geometry and a Somato-Geo Technique practitioner, Dr. Naumov explains he uses specialized assessment techniques to detect electromagnetic interference patterns, going beyond conventional orthopedic and neurological tests to evaluate the electromagnetic function of your nervous system directly. The frequency optimization achieved through these adjustments, he writes, can be measured using electronic equipment that monitors nerve signal characteristics before and after treatment, consistently showing improvement in signal amplitude, coherence, and transmission speed. Patients, Dr. Naumov says, typically notice immediate improvements following frequency optimization, enhanced mental clarity, improved coordination, better sleep, increased energy. And notably, he adds, a nervous system operating at optimal frequency with strong electromagnetic coherence becomes more resilient to electromagnetic interference from environmental sources, wireless devices, electrical equipment, and other artificial fields. Long-term Somato-Geo care, he explains, creates cumulative improvements in nervous system function, your body becoming more efficient at transmitting information, more resilient to interference, and more effective at coordinating the complex activities required for optimal healing. When a specific spinal segment is corrected through precise geometric positioning, Dr. Naumov writes, the improvement in electromagnetic transmission creates a cascade of positive changes that spread throughout your entire nervous system, like ripples expanding across a still pond. This happens, he explains, because your nervous system operates as an integrated electromagnetic network. Nerve pathways from different spinal levels interconnect extensively within your spinal cord and brain, so improvement in one area enhances communication throughout the entire system. Your sleep quality, he writes, often improves dramatically following corrections, because optimal spinal geometry enhances the electromagnetic coherence your brain needs to coordinate the neurological processes that regulate sleep cycles and recovery. Immune function, he adds, typically shows remarkable improvement too, because immune coordination depends on clear communication between your brain, spinal cord, and immune organs like your thymus, spleen, and bone marrow. Digestive function, Dr. Naumov explains, often normalizes rapidly because the nerves controlling digestive organs originate from specific spinal levels and require clear transmission to coordinate the complex sequence of muscle contractions and enzyme secretions involved in digestion. Hormonal balance, he says, frequently improves as well, because hormone-producing glands depend on precise electromagnetic signals to coordinate release with your body's changing needs. Cardiovascular function, he writes, typically shows improvement. Heart rate variability and blood pressure regulation, both benefiting from optimized spinal geometry. And mental clarity and cognitive function, he adds, often improve too, as blood flow to the brain improves and electromagnetic interference around neural communication is reduced. This cascade effect, Dr. Naumov emphasizes, continues to unfold for days or weeks following correction, energy levels rising as electromagnetic coordination reduces wasted energy and stress resistance improving as your nervous system regains the ability to coordinate adaptive responses without interference. Dr. Naumov shares a series of patient accounts from his own practice to illustrate these principles in action. It's worth noting, before we continue, that these are individual case descriptions from the author's clinical experience, not controlled research studies, and results like these are not guaranteed for every person. He describes a 16-year-old student struggling with severe anxiety attacks that interfered with school and social life. A geometric analysis, he writes, revealed distortions in her cervical spine that were creating electromagnetic interference with brain centers responsible for emotional regulation. Following corrections to her upper cervical spine, he says, Her anxiety symptoms resolved within 2 weeks. He describes a 45-year-old construction worker who had lived with chronic fatigue for over 3 years, unable to work and dependent on multiple medications. After 6 weeks of care, Dr. Naumov writes, his energy returned and he resumed physical work, eventually discontinuing his medications under his doctor's supervision as his condition improved.
It's important to pause here.
Decisions about starting or stopping any prescribed medication, including for chronic fatigue, blood pressure, or any other condition, should always be made together with your physician. No book, technique, or audiobook should ever be the basis for changing your medication on your own. Dr. Naumov also describes a 35-year-old mother whose chronic digestive issues resolved within a month of care, once geometric distortions affecting her thoracic and lumbar nerve supply were corrected. And a 28-year-old athlete, he writes, saw dramatically improved healing capacity and fewer injuries after 3 months of treatment, as electromagnetic communication with his musculoskeletal and immune systems improved. He describes a 52-year-old executive whose chronic insomnia and high blood pressure improved within 2 months of care, as distortions affecting the brain centers regulating sleep and cardiovascular function were addressed. Again, any changes to blood pressure medication must be made in partnership with a physician, never independently. Finally, Dr. Naumov describes a 67-year-old retiree whose declining memory and cognitive function showed marked improvement within 6 weeks of care, as corrections to his cervical spine improved blood flow to his brain. These accounts, Dr. Naumov writes, illustrate the healing capacity that can become available when electromagnetic interference is addressed through precise geometric correction. They are offered as illustrations of his clinical philosophy, not as promises of a specific outcome for every reader. Dr. Naumov closes this chapter with a recap and a set of practical steps. The Somato-Geo Technique, he reminds you, goes beyond traditional mechanical adjustment to target the geometric relationships and electromagnetic properties of spinal alignment, recognizing that your spine functions as a living antenna for your nervous system's intelligence. He offers several action steps you can begin today. First, postural self-assessment. Stand in front of a full-length mirror in your normal posture. Notice whether your head sits directly over your shoulders, whether your shoulders are level, whether your spine maintains its natural curves, and whether your pelvis appears level. Take photos from the front, side, and back to document what you observe. Second, gentle spinal decompression. Hang from a pull-up bar for 30 seconds 3 times daily, allowing gravity to restore proper spacing between your vertebrae. Third, frequency optimization breathing. Breathe in for 6 counts and out for 6 counts, maintaining smooth, even breathing that promotes coherent electromagnetic fields. Practice this for 10 minutes, twice daily. Fourth, optimize your environment. Adjust your computer monitor to eye level. Use supportive seating that maintains your spine's natural curves, and organize frequently used items to avoid repetitive geometric stress. Fifth, track your response. Use a simple daily rating system to monitor changes in sleep quality, energy, mental clarity, and physical comfort, so you can see whether your efforts are producing real improvement. And sixth, as the founder of Somatic Geometry and currently the only Somato-Geo Technique practitioner within the United States who pioneered these geometric and electromagnetic principles, Dr. Vic Naumov can be reached at www.naumovhealth.com for precise, individualized corrections.
Remember, Dr. Naumov writes,
That you are the medicine, and your body contains the geometric intelligence necessary to create and maintain optimal health when structural interference is removed and electromagnetic coherence is restored. That's episode 4 of You Are the Medicine. If this episode gave you a new way to think about your spine and the chiropractic adjustment, do 3 things right now. Hit like, drop a comment, and tell us which action step you're going to try first. And share this with someone who needs to hear it. Subscribe to the channel and turn on that notification bell. Episode 5 is coming next. Until then, remember who you are. You are not misaligned. You are not broken. You are the medicine. We'll see you in the next episode.